everybody. Good evening. I have the Scar Lady with us tonight. This is Dr. Jennifer Malasan, who's a physical therapist, and I just learned how to say her last name, so I'm proud of myself. But she just wrote and published a new book, and I thought it would be great to have her on and discuss everything about scars, because I know so many of you have questions. You come to me with questions, and why not ask the expert, the Scar Lady? So thank you, Dr. Jen, for joining us today. Like, as a PT, I get the question all the time, like, how did you get involved in wounds? So how did you fall in love and focus in on working with scars?
Yeah, well, like you, I've always not minded wound care and done it at various points in my career. So I guess that was an early start. But several years ago, I took a weekend continuing education course, and the instructor was like, oh, this isn't a different level, but let me throw in this little freebie for you here. And he showed us how somebody's scar could significantly impact the way their brain actually found their muscles. I was like, wow, that's really cool. So it's the concept of motor control. How our brain chooses to move us is driven by sensory information the brain gets from our skin. So I started asking my patients about, like, really diving into prior surgeries, skin traumas, tattoos, piercings, and just experimenting with testing to see if those areas of skin trauma or scars were affecting the way their brain was using their muscles. And what I found was that there was a really high correlation between having a scar or an area of skin trauma and a muscle, or in most cases, multiple muscles, having trouble with firing the way that they're supposed to. I was like, that's pretty cool.
That is pretty cool.
So
do you, I don't know what that was. Do you,
feedback? Getting a little bit.
I don't know what that is. So do you find like a difference? Because I think people probably don't think of like tattooing as being scar producing.
Right.
Does it need to be, do you see any difference like in where it's located or how big it is or how many they are?
Actually, I don't. I've seen people who have just one small tattoo have that tattoo be influencing muscles around it. Commonly, people will have them like on their lower abdomen or low back, or maybe on the back of a shoulder. And it's because of the multiple incisions or the breaking of skin to put the ink in, that the brain gets different information from, because the skin's not the same anymore. It's had to heal, and so it changes movement.
Are they always aware of that?
I'm sorry, can you say that again?
Are they aware of that?
Like, the people getting the tattoos, or
like the people, like, are they coming to you and they're bringing that up, or it's something that you're finding through assessing?
I've only maybe had one or two patients ever, and asking people about this now for the last 4 years pretty often, who are like, yeah, I think my tattoo might be causing me issues, or linking it to, hey, this pain did start a couple months after I got this most recent tattoo. Most people have no idea that tattoos and skin trauma like that can end up being a potential cause of movement or pain issues later on down the road.
I'm thinking of a client of mine that has had a reaction to the red dye in her tattoo, and like everywhere else is like a nice flat scar, except for where there was red. It looks like it's all raised. Like, instead of it looking like red ink, it's all like raised everywhere.
Wow, that's really interesting.
Yeah, it looks kind of cool, but it wasn't like the
unintended 3D effect.
Yeah, it wasn't the intended effect, but yeah. So when you say like you're working on someone's scar, what does that mean to you?
Well, it starts off with an assessment of how the skin is moving and finding which directions there are restrictions in fascia, which is connective tissue that helps form the support system of our body. And then going on from there to figure out how their body is reacting to that. So for example, if somebody had an abdominal scar, there's 2 really easy tests to have people do that people can try at home. And one is simply to stand on one foot and do each foot and see what happens. And to take inventory of your body, like, are you holding your lips together? Are you holding your breath? Are you toppling over when you try to stand on one foot? Are your toes clawing the floor for dear life, or are your toes sticking straight up? Is your ankle wobbling, or is it able to be still? And then you touch your scar or tattoo or belly button ring or whatever skin trauma might be and redo the test and see if there's any difference. And oftentimes, because you touch the scar, your brain gets different information and you're often more stable.
Cool.
So after we work on figuring out where those skin restrictions are, we can get the skin moving better, and then incorporating movement right away specific to the area and general movement, so the brain can kind of be reintroduced to those muscles and say, hey brain, meet muscles in the right way so you work together well again. And then you can actually build strength once the brain has a good communication signal open to the muscle.
So how often, oh, my sound is weird. How often or how soon would you start this kind of work? Like, is it right away? Do they have to have an issue, or can they be doing things preventatively?
If you have no issues with open wounds and you're just curious, you can definitely start on it right away. If you do have an open wound, the wound needs to be fully closed and healed. And if you're under medical care, like if you've had a surgery or procedure, you need to be released from your physician. Like, good to go, wound is closed, and not have any wound issues. And I am a huge proponent of starting with like very, very gentle fascial release, and it only takes an ounce or 2 of pressure. So it's so gentle that you're not going to hurt yourself. Or like I don't know if you can still see it. I had drawn a line on my arm for a video I was filming earlier. Like, say this is my cut, and it's healing really well, but I could even start working up here really gently, because if we get the skin farther away to move as a byproduct, what's down here will move too. So that's kind of my general rule of thumb.
Gotcha. So I know we talked about this earlier. Do you have any like specific products that you recommend on the skin after it heals? I know I get this question all the time.
I don't have a ton of specific products. I do think keeping your skin just at a healthy level of moisture and being well hydrated in general, which helps with your skin staying moisturized, are 2 of my best recommendations. I personally like to use coconut oil on my skin as a moisturizer, just because it's pretty clean and natural and not filled with a lot of chemicals, but there are lots of products out there.
I know I'll get often the question about vitamin E oil, or people tell me like that's what they've been using, and there's actually that's not the best thing out there on the market. Yeah, so coconut oil for sure. Anything natural is going to be better. People do have, if you're worried about like the appearance, like the Mederma type, the scar creams are fine. If you tend to scar raised, like keloid or hypertrophic, you probably will kind of know that anyway, because you'll have it somewhere else on your body, and they tend to scar the same. Things with silicone in it, either a silicone tape, or even the silicone lotions can help you get like a nicer topical appearance, which has 0 to do with what's happening underneath.
Yeah.
But topically wise. And if anyone has any open wound issues, feel free to reach out. But so is it ever too late to work on a scar?
No, it is not. This is a
Cool.
thing I wish millions and millions and millions of people knew, because I have worked with many, many patients and clients over the years who have had issues from a scar that they got decades ago in childhood. They're like, oh, my kid's 25 and I had a C-section 25 years ago and they have back pain now. So no, it is not too late to work on a scar. And the beauty of that is our brain has an amazing capacity to regrow and shift and change, called neuroplasticity. And it does slow down a little bit as we age, but it's still there and has the capacity for new learning and better movement. So
I completely agree. I see folks all the time and they're coming to me for some weird pain and they don't tell you, right? Like you forget about the surgery you had 10, 20 years ago and you don't even like
very
think
much
about
so.
it or look at it. And it's not till I'm like, what I'm doing on you is not working. And you roll them over or something and there's like a whole bunch of scars on the belly and you're like, we were working on the wrong thing this whole time.
Yeah.
So every like surgery, injury that you've had is important to talk to your care provider about, especially if you're getting some body work done or if you're someone that is like always needing body work.
Mm-hmm.
And it's just like never quite right. And you're always looking for a different practitioner. We're probably not finding the cause, and it may have something to, it's at least something to explore.
Yeah. I'd like to also add to that and for a minute talk about the emotional effect that scars can have, because our brain stores trauma in scars and it is a great scorekeeper of trauma. Since even when like you were in your mother's womb, your brain has been storing trauma that you even can experience in utero for your whole life. So that adds a layer of stress to your nervous system, and sometimes that needs to go hand in hand with the physical work for people to have, more full healing and freedom than just the physical. So those two oftentimes can go hand in hand.
So
it's a good thing to explore if there's a block, with.
Oh yeah, I agree. Do you recommend something? Are you talking about seeking like a therapist? Are you talking about, and like, what does that mean to you?
Both. When I work with people in scars, I created, I call it my freedom and power statement, but I ask the person to repeat after me out loud, or they can change the words to make it, whatever they need to. But the gist of it is, brain, I give you permission to release the trauma that you're holding in, and I'll have them name this area, this scar, like by name, and then tell their bodies that they give it permission to let all the muscles work the way that they're supposed to. And I found that to be really powerful. And sometimes people have emotional responses. And by them just giving their body permission to let it go, sometimes that's enough. Or if I'll be doing a fascial release and like I'm just stuck and it is just not going, I'll be like, would you please give your forearm permission to release? And they do, and my hands start sliding away. I do also recommend professional counseling if there is a need, to do deeper work in that area as well.
Gotcha. All right. Do you do any like energy work, like Reiki or?
No, I don't do any Reiki.
Gotcha. Have you ever tried it?
I haven't.
I have. It's pretty cool. So how, like, give me some signs of if someone is like listening to this and they're like, I've had what are some signs that maybe they need to do some of that work? Sure. How would they know?
Funny you ask, because I have a video coming out tomorrow called 5 Ways Your Scar is Asking for Help. So I'll share 5 ways with you. Since we were just talking about the emotional things, I'll share those 2 first. One of them is if you have trouble looking at your scar, like you're like, I don't want to look at it. I'll do anything to avoid looking at it. The second is if your scar is very hypersensitive to touch and you're like, don't touch me, or when clothing rubs it the wrong way, it gets irritated, that is a sign that your scar might need some help. Onto the more physical side, if you have scarring that crosses a joint and there's restricted motion in that joint, that scar tissue being stuck down could be a contributing factor to the limited range of motion. And then you can actually check your scar for the mobility by using just an ounce or two of pressure. I'm using it a little bit on my fake scar. And moving your skin in all areas. And you can see like my skin here, I get stuck. So I probably need to do some work there. But like when I come that way, it moves easily. So you're looking for directions where your skin does not move well. And then if you have a scar and you very gently pinch it, it should come up in one arch, kind of like the St. Louis arch. But if you have scar tissue that is really restricted and locked down, your skin will fold in on itself in the middle and look more like a McDonald's arch. So I'll give a fake scar here, and it might look something like that. So at-home ways that you can check to see if your scar needs some help.
Perfect. So what are some of your favorite tools? Like every practitioner, this is just me asking, what are some of your favorite practitioner tools in your toolbox?
I absolutely love using kinesio tape as an adjunct to whatever I'm doing because I can use one piece of tape to do so many things. So I often follow up scar work by doing fascial taping or scar taping. That way the brain gets changed sensory input on the skin from the tape 24/7, even when the person is not thinking about, oh, hey, I should be working on my scar to get it to move better. They're still getting changes to their scar tissue, which is pretty awesome.
In your book, you mentioned dolphin.
Yes, that is one of my favorites.
So I don't know, I'm not familiar with the dolphin. What is that?
The Dolphin NeuroStim is a handheld tool, and it uses microcurrent, and it runs off a 9-volt battery, so not a large amount of current, but it's healing current to the body and the nervous system. And you can set the tool a certain way, and they have a scar protocol. And so this was my scar. I would use the tool all along the scar and anchor the ends, and then there's another step to it. But it literally dissolves scar tissue. Like it converts it back to regular tissue, which is absolutely amazing. And like I will literally watch a scar change if it's kind of more bumpy. I will watch it smooth out. I'll watch the color fade. When I'm done, the skin will move so much better without me doing any manual work on it. And it helps take that layer of stress out of the nervous system. So it's an amazing tool. And it's not invasive.
I'm just looking real quick to see if any questions popped up. But I know that you have just released your book and it's out on Kindle. I'm going to post a link for folks below that they can get access to it, or how else could they get in touch with you?
Sure. I'm on Facebook at The Scar Lady, and I'm on Instagram at The Scar Lady _Dr. Jen, or my website is www.thescarlady.com.
And you are releasing a course too, right? Or you've got something coming out tomorrow. What is that?
Yes, I have 2 awesome things coming out tomorrow. One is called the Scar Lady Bundle, which will be a combination of my book, a journal I wrote to help people process through emotional trauma related to events prior to skin trauma, during and after, and a video where I teach you how to use the kinesiology tape to work on your scars 24/7, along with some pretty cool bonuses. And then I have an abdominal scar course coming out with my Scar Lady protocol that I designed, and it's at home, and I teach you step by step and with video how to work on your scar, get your brain to dial back into those core muscles, and how to breathe properly and build true strength with multiple different levels of exercises in difficulty. So you can start off really easy, and then as you get stronger, work your way on up. And just 15 minutes a day, and I'm recommending people do it at least 3 times a week. But I always like to say, if you change your scar, you just might change your life.
Oh, that. I will definitely post a link for all that information as it comes out tomorrow. I want to thank you for joining. If you have any questions, post them below, comment, go follow Dr. Jen, and reach out, ask questions. We're all here for you.
Thank you so much for having me, Heather.
Thanks.
Good night.